Welcome to this PA5 Truth and Action interview. My name is Mark Friedenberg. In response to Congressman Thompson's recent comment that we seldom hear about improved outcomes under Obamacare, and in light of the debate surrounding the American Health Care Act, also known as Trumpcare, introduced in March 2017, we invited PA5 constituents to meet with us to share their stories about how Obamacare has improved their lives. We hope that Congressman Thompson listens closely to their stories. Here is one of them.
Hi, my name is Leah, and I live in the 5th Congressional District of Pennsylvania. When my children were ages 3 and 4, my husband walked out, and I was left to raise them alone. I found an entry-level job in daycare and went to work from 8 to 5 days a week. I got up early in the morning, I dressed and fed the children, dropped them off at daycare, and went to work. In the late afternoon, that routine was reversed. Evenings were dinner, homework, laundry, and other chores. Weekends were filled with errands, church, and the story hour at our local library. My kids participated in scouts, youth group, track, and band. Imagine how difficult that was as a single parent and full-time employee. Then and now, I benefit from having caring professionals and medications to treat my illness. I live a full and meaningful life. I'm lucky. I have employer-provided insurance. But the new Republican American Health Care Act does not require employers or states to provide mental health parity in medical premiums and copays. Before the Affordable Care Act, I had to pay more than double the copay for my psychiatric appointments as I did for my other physicians. If my former employer decides it no longer wants to cover its retirees, they can drop our health insurance plan. Then we're out in the marketplace. I'm a baby boomer, and the Republican ACA will allow insurance companies to charge me 5 times what they would charge a 20-year-old in premiums. I live on a fixed income. After December 2019, the GOP American Health Care Act drops the requirement that Medicaid and private insurance pay for 10 essential health insurance benefits, including immunization vaccines, maternity and newborn care, and mental health illnesses. Almost 20% of Pennsylvanians are covered by Medicaid. That includes children, the elderly, and people with disabilities. Some of these Medicaid recipients have psychiatric diagnoses. Their illness is so severe they cannot hold down a job. Behind education, Medicaid is the second largest category in the Pennsylvania budget. Under the current Affordable Care Act, the federal government provides about 54% of Medicaid funding, with the state providing the rest. The new GOP plan would slash federal funding to Medicaid. Instead of ensuring everyone who meets income and diagnosis criteria, the federal government would provide a set per capita amount, a block grant. It would require each state to make up the difference between decreasing federal funding and actual cost. Chronic illnesses like multiple sclerosis or serious mental illnesses are costly to treat. Pennsylvania is currently over $126 billion in debt. That's $126 billion. Where do you think the governor and General Assembly are going to find extra Medicaid dollars with an increasing state deficit? Millions of people will either have no Medicaid coverage or it will be reduced in value so much that they won't be able to afford care. What about individuals with autism, the elderly in nursing homes, children with chromosomal disorders, or people with paranoid schizophrenia? Many are on Medicaid. Whose care will be reduced or cut? Psychiatric care is just as life-saving as chemotherapy or surgery. I'm an example of how a person can function with a mental illness and be an active participant in the community and economy. The 2017 health care plan from the GOP says everyone will have access to medical insurance. Access does not mean the same thing as being able to afford premiums and copays. The compassionate and ethical thing to do is to provide every American with comprehensive, affordable health care. I expect Congress to deliver nothing less. Well, I've tried to give it due diligence. I've tracked bills in Congress, and so I've looked at the actual text for the American Health Care Act. I also have done tracking of not only this bill, but other related bills and the things that are going on in the Ways and Means and Energy and Commerce committees in the Congress. I have used the services of research librarians at Penn State University and the University of Texas to do fact-checking. No, I think he should vote against it. The American Health Care Act slashes benefits and protections for Americans with their health care insurance. Representative Thompson, this is a very important piece of legislation. As you know, 34% of the population of Potter County is below the poverty line. That surely means they're on Medicare. Giving per capita block grants to states will mean that many of those people's coverage will be slashed, or they may even do without it. And for people like me on employer-provided plans, we're not guaranteed coverage for mental health illness. Please vote against this. It's not in our best interests.
Thank you, Leah, for sharing your story with us, and thanks to all of you at home for watching. We hope you found this video informative. If you would like to share your own thoughts about Obamacare, Trumpcare, or anything else of concern to residents of Pennsylvania's 5th Congressional District, please visit us at facebook.com/wearepa5. We look forward to hearing from you.